Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Welcome, everyone, for another episode of the Pharmacists Are In podcast, Canada's #1 podcast for pharmacists. My name is Ajit Johal. I'm a BC-based pharmacist, and I'm joined by my colleague, co-host, Dr. John Papasturgio, and we are fresh off the live stream at Pharmacy U, John. Let's talk about that a little bit.
Yeah, I know it's a little different when we're not in person. I like the vibe in person. It was the first time we tried something like that, but it seemed to get a lot of traction. I mean, there was a lot of excitement at Pharmacy U. I've been getting feedback all week. I don't know about you, but it seemed like it was pretty well received.
It was very well received, and I feel like it's just been a buzz every day on LinkedIn and various platforms. I've been getting messages from people I went to school with saying, hey, when's the next episode coming out? I want to see this episode. So it definitely was something that really added to the vibe of the conference. I feel like it was the marquee aspect. We had so many people who wanted to jump on the podcast, and we had quite a few live stream listeners, which was fantastic, and just a lot of enduring sort of momentum for pharmacists after a great event like Pharmacy U.
It speaks to the fact, I think, pharmacists work in these silos and then they get out into the conference environment. And there's not many in Canada anymore, right? I know we talked about that, but like Pharmacy U is primarily the only one that happens for frontline community pharmacists. And, I think the ability to be able to highlight what we do on the podcast and people to see it firsthand and how it's done, I think it's going to increase the interest in what we're doing here. And I think already we're getting some, requests to do other conferences. So it looks like we may be taking this thing on the road. And I think, like you said, it adds something to the conference atmosphere also. So it was pretty fun to do.
It was great. And we wanted to continue our sort of pharmacy community national focus. So really excited to bring our next guest on today's episode, pharmacist Deepak Narang from Alberta. And before I get Deepak to kind of talk a bit about himself and introduce himself, I do have a story. And that story goes something like this. I actually administered the first adult RSV vaccination in my province of British Columbia, but Deepak administered the first adult RSV vaccination in the entire country. So that is truly a remarkable feat. You have this innovation, a excellent candidate to fight a serious respiratory infection for older adults, especially those with comorbidities. And it's all about putting that shot into arms. So congratulations, Deepak, for that first shot in Canada. We're very happy to have you on the podcast. Welcome.
Thank you. Thanks, John. Thanks, Ajit. I'm really excited to be here. And you guys were talking about the podcast. I've been following your podcast for a while now, and you guys are putting out some great content out there. So I'm really excited to be here. And thanks for the shout out for the RSV vaccine. I remember when we did the first vaccine in Canada, and there was a buzz, and we were reaching out to some of our customers or patients, I should say, asking, hey, we are going to be doing our first shot. And then there was a lineup of patients. They're like, oh, I want to be the first one to be getting the shot. And it was a very exciting time for us.
It was, yeah. No, I think it's great that it was kind of featured. It's great that a pharmacist did the shot. And also, you're based out of Alberta, and me and John talk about this all the time. John's done some really great research in vaccines, showcasing the sort of the better the scope, the better the outcome. Being based out of Alberta, you have very advanced scope, but at the same time, you're doing some work. You're running for ACP, is it? Alberta College of Pharmacists. We'd love to know more about that and some of the things, some of the vision you have for Alberta pharmacists to kind of, they're leading the world in terms of scope of practice, but other jurisdictions in Canada are catching up. So what is new and exciting in the world of pharmacy in Alberta?
Yeah, thank you. So you're right. So I am running for Alberta College of Pharmacy council position for pharmacist counselor 2 position. So you're right, Ajit. Alberta has had the most expanded scope of practice in the country, and we've had it for a number of years now. And our pharmacists have really enjoyed it, and they're utilizing the scope every day. Helping the patients, helping Albertans deliver access, deliver care to our patients. And so, to your point, yes, I am running for Alberta College of Pharmacy pharmacist counselor 2 position, and this is where I am on this podcast to talk about my campaign and to talk about further opportunities that we have in Alberta.
That's great.
So Deepak, before we get to kind of your can, this is different for us. I mean, we don't usually dive into pharmacy politics. I mean, we comment all the time, but it was great to have you reach out because I think it's an important part of the profession, this ability to self-regulate and uh, you know uh, uh, make sure that the profession is going in the right direction. And I know in Alberta, Ajit mentioned the fact that you guys have the most uh, you know, evolved scope, but there have been some challenges in recent years. I know some of the reimbursement got cut back, and we were surprised to see that because I know, all the great work that was being done there. I mean, the budgetary constraints, are happening in every province. How did pharmacists react to that? And I know, there was some pushback, but we didn't hear much about it in Ontario. But it was just substantial cuts to reimbursement for some of these clinical services.
Yeah, that's right. Actually, we had budget cuts, I would say about 18 months or so ago. It was November 2024, if I remember correctly. And there was significant budget cut at that time. And it was in, I would say, a couple of different lines in terms of the services we perform in Alberta, but it was still quite significant. And pharmacists did feel the impact of it in how we perform services and how we deliver the patient care in Alberta.
So what would you say the biggest kind of election issues are right now facing Alberta pharmacists? Like what are they looking for? Is there anything specific with respect to representation and what do you think you have to offer?
Yeah, so when we talk about Alberta College of Pharmacy, John, right? So Alberta College of Pharmacy is a self-regulated profession, like you mentioned, but college is all about the regulation, right? So it's a self-regulated profession. It regulates the pharmacy profession in Alberta, and we have two, I would say, different professionals, pharmacists and then pharmacy technicians, right? Who are regulated by the college. And the college's main job or role, I would say, is public protection, right? So they regulate the profession by putting out the standards and the policies, to make sure that all the regulated members, all the licensed pharmacies in Alberta comply with those standards, right? And then whereas and it's probably a good point here to differentiate ACP, which is Alberta College of Pharmacy, versus RXA, and that's Alberta Pharmacists Association, right? Alberta Pharmacists Association is all about advocacy, whereas Alberta College of Pharmacy is about regulating the profession, right? And I am running for Alberta College of Pharmacy Council, and it actually comes up quite a bit as I am campaigning, talking to the regulated members. A lot of folks will dive right into it as they hear that I'm running for ACP Council position. Whereas there are still some folks, and probably the newer ones, who are entering the workforce now, will ask me, so what is the role of ACP? Or even what is the role of ACP Council, right? So like I mentioned, role of ACP is to regulate the profession, putting out the standards, regulations, whereas the role of council is, think of it like a board for a company. And then just like the board of a company does not run day-to-day operations, similarly, ACP Council does not do daily operations to do with the Alberta College of Pharmacy. But their main goal is to set out the strategic directions to see where either ACP or where the profession is going. And also with the regulated members, their goal is also to bring frontline perspective. onto the table to see, okay, the regulations that we are putting out and the policies that we are putting out, how does that impact the workflow? How does that impact the daily operations in the pharmacies? And we have different pharmacy settings, similar to every province. We have community pharmacies, then we have hospital pharmacies, long-term cares. So the settings may look very different. And which is where the main feedback I am getting, and I am experiencing it myself as well, is the practical and workable regulation. So the regulation that actually is practical and workable in every different setting in pharmacy settings, right? Whether we talk about hospital, long-term care, or community pharmacies. And then the execution of these regulations, these standards into different settings need to be consistent. So that's the main thing we talk about, and we can further dive into it.
One of the things, Deepak, I've always, struggled with this. Obviously, the mandate of the college is, self-regulation and also to protect the public. But what I've seen in recent years is, the public, the colleges have mounted these campaigns to increase public awareness that here, this is, college is here to protect you if you have an issue, whatever. And across the entire country, we're seeing the number of complaints towards community pharmacists, community pharmacies have skyrocketed. I've heard this. Uh, and the challenge and the issue I face with this is we've made it so easy to complain that countless numbers of hours are wasted on like frivolous issues that come up in pharmacy. They're not even patient care issues. I've seen in my practice, I've seen anywhere, customer service issues, this and that. The amount of time and stress that our poor frontline pharmacists are faced with kind of addressing it's a ton of work. And I think if I were in Alberta, I'd be asking you, what's the plan? And I think I'd ask the same thing to someone running for a board seat here in Ontario. This can't continue. The reality is we're very different than other healthcare providers in the sense that the patient has direct access to us constantly, and we're dealing with this onslaught of, issues, customer service, patient care, filling scripts, all these things. And because of this easy access to us, we're also a very easy target. And what I would like to see is someone in these colleges step up and say, okay, like this frivolous stuff, we've got to start kind of peeling back the onion and eliminating some of these things because it's wasting way too much time. I don't know if this is an election issue in Alberta, but I absolutely feel like it would be one here in Ontario.
Yeah, I hear you, and you're right about it. So that's another role of ACP. In addition to what I mentioned, another role of ACP is to about hearing complaints, right? And then public hearings about, or I would say hearings about the regulated members, and that's after the complaints from the public. So have the complaints gone up? I don't know the exact number, but I would imagine yes, the complaints have gone up. And you're right about it that pharmacists are easily accessible healthcare professionals. We are there, whether you talk about OTC counseling or you talk about medications counseling, we are the primary access for care to all Albertans, and I would say to Canadians. And with that comes the responsibility of, providing the care. And you walk into any pharmacy, you'll see every staff in the pharmacy basically busy with the workflow they have, the work that they're doing every day. On top of that, expanding scope is there, but with that comes the expectations. Now, do the expectations have also all the support that pharmacists need to perform those tasks, to perform that scope, So adding more public awareness to what pharmacists can do is very important, and it helps deliver the patient care. But with that, we also need to make sure that we are giving all the tools and all the resources to pharmacists as well. And we're making actually their life or job, I would say, easier or more workable, not adding basically meaningless tasks or more work in terms of paperwork, so that they can actually do what really they are there to do, which is to provide patient care, right? If that answers your question. So 100%, I'm sure it is going up in terms of hitting complaints, and it's because of the increase in public awareness, increase in the access to patient care. But this is partly kind of also falls my campaign, the platform that I have put out there, that we need to have regulation that's practical, that's workable, but at the same time, even that needs to be consistently executed across the profession.
So what exactly is it? What's the platform? Sorry, Ajit, I jumped in there, but yeah, like you've got this broad audience now here. It's national, but I'm sure we have a good sized audience in Alberta that listens. What differentiates you from kind of the other candidates that are running?
Yeah, so I've been a community pharmacist for 14 plus years, and out of those 10 plus, I have been a pharmacy owner as well. But in addition to that, and I've known you, John, also being on the board in some leadership roles, right? Some advocacy work I have done, continuing education. So I've had exposure to both frontline practice, but also system level discussions, right? But honestly, what grounds everything for me is still being in the pharmacy day to day, because that's where you really see that, what works and what really doesn't work. And that's the basis of my platform as well. And if I could put my platform in two different buckets, so to speak. First one meaning practical workable regulation and its consistent execution, which we've talked about already a little bit. And then second one, I would say scope expansion and workforce management as well. So when I talk about practical workable regulation, it's already touched upon it a little bit. The intent behind many of our current standards that we have in place is strong, and it's grounded in patient safety. And that's something we all support because they're there for a reason. But the next step is making sure that these standards are also supporting the workflow, efficiencies, and clinical decision making in our day-to-day practice, right? Because pharmacy, like I said, it isn't one environment. You would have urban community pharmacies, that are busy. Then you have rural sites with limiting staffing. Then you'll have hospital, long-term care. So each one has different realities with one set of expectations, right? So this is where the rubber meets the road. That are the expectations, are the regulations practical and they're workable, right? And then the consistency in how we are implementing those standards. Consistency in one of the way you make sure that these standards are being implemented on site is by having the site inspections by the colleges, by the assessors. And what I'm hearing from regulated members as part of my campaign is that there is quite a bit of inconsistency, when we talk about these assessments, right? So we're not asking for different standards. We're basically asking for that, to have the consistency among these execution of these standards. So the solution that, I'm framing here, my approach is actually very simple. That, don't add more rules or don't create more layers here, but instead reassess what we already have and then make it practical and workable and have it consistently executed.
Hmm.
No, that makes a lot of sense. I think it's really important to have a frontline perspective. I think it's often a challenge when individuals are far removed from practice, and it's almost like that ivory tower talking head type situation where it's very much an abstraction. But I think having like you're saying, the rubber hits the road and seeing exactly what's happening on the ground is definitely an asset. I had a question about scope expansion because scope expansion is something we've been saying in BC, John's been saying in Ontario, and basically our argument for scope expansion is look at Alberta, right? So you're talking about scope expansion. I'm curious to know what scope you're looking for, and is it for pharmacists or is it for other regulated professionals under the umbrella as well?
Absolutely. Great question, Ajit. So you're right. Alberta has had the most expanded scope of practice in the country. But when we talk about the most expanded, I'll divide that in two different categories. One, when we talk about most expanded scope, we're talking about pharmacists. But when we talk about pharmacy technicians, our scope is still behind some other provinces, right? whereas pharmacy technicians are also a very critical part of our team, right? And so my proposal here is that we need a holistic review of the pharmacy technician's scope of practice. And one example I would give is, John, you guys can have pharmacy technicians inject in Ontario, right? So now that's just one example, but like I said, my proposal is, we need a holistic review. Where else can we have pharmacy technician scope, reviewed, so that pharmacists can have the help from the pharmacy technicians and focus more on clinical, focus more on patient care. So that's one side, right? But at the same time, also, giving the support that the pharmacy technicians need, or giving the recognition that pharmacy technicians need. So that's the technician side. On the pharmacist side, you're right. And we're proud of the scope we have, and we are utilizing it every day to provide care to Albertans. So if I remember the numbers correctly, about 2/3 of Alberta pharmacists have something called APA, which is Additional Prescribing Authority, which gives you the authority to prescribe any Schedule 1 medication other than the narcotics, controlled and targeted medications. But when we look at some other jurisdictions, not only they're catching up, but there are some other things where their scope is even more than what Alberta pharmacists can do. And if I can give one example, I would say otoscope, is one of them. The use of otoscope to look into the ear to see whether, for example, ear infections. And I believe Saskatchewan is a province where there is a pilot going on right now where they're looking at pharmacists utilize the otoscope to provide further patient care, right? And we see these cases in our practice all the time, where we would have, especially kids come in and then we cannot. So that's where I'm saying, I see it, I am visiting pharmacies as part of my campaign, and I'm seeing all the amazing work our pharmacists are doing in providing patient care, but they're ready for more. They're ready for more, to do more, to help patients more. And that's where further review of the scope is required.
And
That's a really
Deepak,
good
one of the
point.
things,
Yeah.
sorry to think, one of the things that comes up once in a while here in Ontario that I hear, and let us know if is this a rumor? Is this something that's actually be considered because of the such advanced scope in Alberta? We keep hearing this talk about potential advocacy towards billing numbers in Alberta. Pharmacists being able to do so much and prescribe that there is this appetite for them to pursue direct reimbursement. Is that something that's true, or is it just a rumor that floats around the country?
So I'm sure there are talks about it, and there are pharmacists who are talking about, okay, so I am providing all these services. So and pharmacies right now can bill directly to the government, but not pharmacists. You still have
Yep.
to be in a pharmacy, right?
Yep.
So you still have to be attached to a pharmacy. But are there conversations about can pharmacists have a standalone practice without having the attachment with the pharmacy? Yes, the conversations are out there, but there is nothing that allows a pharmacist right now to have a practice on its own. So they still need to be working within a pharmacy, but also to the point, we also have many, many, many pharmacist-led clinics now. It's like pharmacist
Yep.
walk-in clinics or care clinics, and these are also, my understanding is the way Alberta College of Pharmacy looks at it is it's an extension of our current pharmacy, right?
Yep.
So there are pharmacists working there, providing care, utilizing a lot of tools such as point of care testing as well, but it's still part of our pharmacy. So to
Yeah.
your answer, yeah.
Yeah, that's the way I understood it too. It just seems, I think, because of the scope, there's always this kind of looming kind of discussion in the background. But it'll be interesting to see where that lands. Ajit, did you have any final thoughts? Because I noticed we're getting kind of tight on time here, but maybe I think I'll pass it to you to close, maybe.
Yeah, no, I thought that was really interesting because, we often think of giving pharmacists scope and that will lead to an outcome. But I think, Deepak, you talked a lot of your experience in sort of system and policy level analysis is you need a full team approach to enable the pharmacist the time to even do that, right? So I think it's interesting, the pharmacy technician administering immunizations, I'm actually presenting to the Alberta pharmacy technician group in the summer about ways that this model could work, because it's just like anything, just because you give someone the scope, it's just anytime you make a regulatory change, obviously things need to be done, changes need to be made. So there has to be a good sort of motivation to do so. But, sort of innovative vaccine delivery models, kind of like what you do with RSV and long-term care, those can truly be scalable and sustainable if you have access to more immunizers, both in the pharmacy and outside the pharmacy. So I think that was a really good sort of insight on expanding the regulatory scope, despite pharmacists having the most advanced scope. And then even how do you prescribe antibiotics better for something like otitis media, which, by the way, otitis media can be mitigated by pediatric pneumococcal vaccination, but even then, it's a very common infection. So it's a huge access to care, and subtle scope changes to allow better optimization is really good. I think that's thinking in the right direction. But I learned a lot in this podcast, and I assume, John, you did too. I guess we'll give you the final word, Deepak, about what you plan to do in Alberta. And for those who are listening from Alberta, when is the deadline, and how do people vote? I assume it's electronic. I remember when I ran for board position for the BC College, people had to mail in ballots. My goodness, 10 years ago. So I'm glad. I don't know what it looks like now, but I'll give you the final say to those listening in Alberta, why you should vote and how to do so.
Yeah, no, I appreciate it. So, in my final thoughts, I always think of it, okay, where do you see pharmacy going in the next few years? And with everything what we've talked about, it's more clinical care to all the Canadians, not just Albertans, for sure. There's no question about it, right? The way it's going, the scope is expanding across Canada, but that only works if we build the right foundation, right? We have, practical regulations, we have smart technology. That's something we didn't talk about part of my platform, that, we need to also implement the right technology to help pharmacists and technicians deliver the care. And then scope expansion, but also the strong workforce. So with that, I would say, the message is very simple, that, this election matters because it shapes how we practice every day, right? So what I would, ask my pharmacists and pharmacy technicians, colleagues in Alberta, is that, please vote if you haven't already. I'll be honored to have your vote and your support. So how can one vote? The voting is already open. It's open till May 7th at 4:30 p.m. Alberta time. And it's very easy. Log into My ACP, which is the portal we use to go on Alberta College of Pharmacy, and then go to My ACP. And once you are logged in, click on Council Election, and then click on Vote Now, and then you'll be able to vote. One thing actually I'd like to mention here is that, so this time there is a bit of a change in Alberta pharmacy elections. This is a provincial election this time. It used to be district elections, and now it's a provincial election. So all pharmacists and all pharmacy technicians in Alberta can vote. And there is one position for the pharmacist council position, and one position for pharmacy technician council position.
Well, Deepak, thanks. Good luck with the election. Let's let us know how you do. I mean, doesn't always make national news, but we'll see. We wish you all the best, and it seems like you've got a pretty sound strategy there, and I think they'd be lucky to have you. So thanks for coming on, and I'm sure we'll see you on our travels coast to coast.
Sounds good. Thank you so much. Thanks for having me. Appreciate it.